Dr. McDonald, first thing, the CDC yesterday came out with some new guidance for people who are fully vaccinated, don't have to wear masks around other people who are fully vaccinated. What do you think of that? Is that kind of the same direction you think things will go locally? Would you advise people that that's okay to follow that guidance, to let your guard down a little?
You know, I think it's an exciting development, and I think it's showing where the research is going. And one of the things we're learning here is that it doesn't look like vaccinated people are as efficient as transmitting disease. So I think it's an exciting development. I kind of ask people to hold off on that implementation just yet. Keep in mind, the CDC gives recommendations to states, then we have to implement it. And we have executive orders and mask mandates. So give us a little bit of time to implement that for Rhode Island. But I think it's optimistic and I think it's good. We're heading in the right direction. This is the type of thing that gives me a little bit of hope. And I was thrilled that the CDC came forward with this. It's a nice step on their part.
Have you all tried, somebody sent me something that Rhode Island may have kind of updated its travel guidance somewhere along these lines, in terms of if you're fully vaccinated and what you can do and not do. Do you expect things to start loosening up here?
Yeah, I think you're going to see changes come along. In other words, one of the things you're going to see is as we see more and more people get vaccinated, what you're going to see is more and more loosening up of things. And I think you're going to see some of this where quarantine isn't going to be as applicable to people who have been vaccinated. And I think that's something we have to just shape for what that looks like for Rhode Island. But I think travel a little bit easier as well. Obviously, there's implications for our economy as well. I think the main thing to keep in mind, though, is that the vaccines just save lives. And I think that's really the big thing here is like part of why I'm so hopeful about this is I, like everybody else, just want to stop seeing that we're losing our loved ones and seeing our friends go in the hospitals. And this is where I'm so thankful we have 3 effective vaccines right now. And this is a good time. It's a good time. And the vaccine supply is increasing. So I'm very happy to see that as well. So I love the momentum I'm seeing in the state right now. It's a very exciting time to be here.
I was at the announcement earlier today with the governor and Dr. Alexander Scott about the teacher vaccinations. I know there's been some concern about the people who were in the next priority group, 60 to 64-year-olds and those with underlying conditions. What do you, the governor and Dr. Scott have said that that's still on track, sounds like pretty soon. What do you say to those people who seem to be concerned that they may be getting pushed back a bit in line?
Yeah, so you're not forgotten, and you're never going to be forgotten by the Rhode Island Department of Health. So we're still on track for that, and it's a very special group of people. I certainly want people to know that people who have diabetes, cancer, heart disease, you know, people have a hard time breathing with lung disease, you are not forgotten by the Department of Health, and we're getting to you soon. I expect we're going to make an announcement in a couple of days about that, but our plan was mid-March, and we're still on schedule for that. And, you know, the way I would look at it is we still can prevent the spread, right? So it's just, we all have to wear our masks, and it's going to take a while for the vaccine to be effective. And so I don't see a delay for that. And, you know, keep in mind, it was a presidential directive. So the whole country is trying to get on the same page as something. And I think that's something to celebrate a little bit. It's like getting the whole country to unify on one thing during the pandemic would be a good thing. If we can get our country more united during approaching the pandemic, that just bodes well for all of us.
Do you want to weigh in on what the Texas governor did?
Yeah, I'm a little bit surprised that Texas, Montana, Alabama, and some other states like Wyoming are lifting mask mandates so quickly. I'm concerned because when you take away the mask mandate, you really do put not just the people in your state at risk, but those of us in the country at risk. And I think what people are forgetting is the variant strains are out there. And what I worry about is when we have people having more people get infected, we do risk more variant spread in the country. So this, in my humble opinion, wasn't the time to lift the mask mandate. And I think in Rhode Island, you know, keep in mind, we're just trying to keep everybody safe a little bit longer. I think we're 6-8 weeks maybe from herd immunity for the United States if we stay on track. When Texas and other states head in this direction, it puts that plan at risk. So I'm concerned about it.
Well, I'll ask you a follow-up since we're on kind of that topic of travel and people moving around. What's the concern level with college spring break?
I'm very concerned about spring break. I saw some pictures over the weekend of people in Fort Lauderdale, and it was like they were living like there was no pandemic. That's just irresponsible. And I'm, you know, I worry about parents who sent their kids to spring break. Like part of me, I have a kid in college too. You know, part of me is like, what were you thinking? But this is not okay. And the problem is college students are thinking, I'm not at risk. But what they're missing is the more people who have the disease, the more people who could get the variant and then spread it to people when they get home. And what I worry about with spring break, why I think it's a real risk for the nation is y'all went to Fort Lauderdale in Florida, and now you're coming back to the rest of the country. you're putting the whole nation at risk right now. So I'm very concerned about spring break.
Has there been any messaging to the universities and colleges in Rhode Island about that?
We've had a lot of good conversations with our universities and colleges in Rhode Island. I like what I'm seeing. You know, I'll tell you one thing. Talk about unified plan. A lot of great testing going on in colleges. The colleges are enforcing our guidance with their students. I like what the Rhode Island colleges are doing. They get it. And I think that's very responsible. We're not seeing mass gatherings. We're seeing some cases, but we're seeing the colleges handle it right away. So I'm very pleased with what I see with our local universities.
Okay, and I'll backtrack now to the next group of vaccinations and the teachers. Do you expect when this all opens up, I know they're putting the teachers in the town sites, you still have the state clinics. Do you expect when that next group opens that there'll be kind of that backlog of people trying to get online and hit the refresh button and spend some significant time trying to get an appointment? Or do you think there are enough openings?
No, there's a lot of people in the next group. Like it depends on what numbers you look at, but in that 16 to 64 group, there's almost 200,000 people in that group. That's a lot of Rhode Islanders. And so there's going to be a backlog for those folks, but we knew that all along. And, you know, we're going to get through those people as quickly as we can, but we're getting more vaccine supply. You know, keep in mind, we've only been vaccinating for like 84 days in Rhode Island. And our supply used to be 14,000 doses a week. Now we're up over 47,000 doses a week. And I hear good news about our future here. So I'm much more optimistic about that vulnerable community, and they're not forgotten.
Just to be clear, you said 200,000. That's the people with underlying conditions?
Yeah, the people 16 to 64, it's almost 200,000 people who fit into that group. And keep in mind, we're talking about anybody who has diabetes, type 1 or type 2. Some people have lung disease like chronic obstructive pulmonary disease, emphysema. There are people with cardiovascular disease, and there's people with compromised immune systems. And there's other people in that group as well. It's a really big group of people and a real important group of people.
And so do you expect it to take a long time to get through that group then, or you just have to see what supply is coming in?
Yeah, we have to wait and see what the supply looks like, but it's conceivable it could be done within 3 or 4 weeks. And I know that sounds a bold prediction here, but with what I see with vaccine supply and expected uptake, I think it is achievable within 3 or 4 weeks.
And just with the teacher vaccinations, and I know, you know, the announcement today was that they're going to do the teachers at these municipal sites. I know Dr. Alexander Scott had said a few weeks ago that the state wanted to move away from the municipal sites because it was kind of clogging things up with trying to disperse all that vaccine to so many sites. Has there been a change of thinking or a change of directive with the new governor coming in as opposed to Governor Raimondo?
Yeah, Governor McKee's his own man, and he's been very helpful so far, and he's working with people. He's got a wonderful relationship with the municipal leaders, and I like the momentum I'm seeing here. And I think, you know, one of the things that I've seen since he's taken over is this action, and there's great action heading in the right direction, and that's something to be celebrated.
Are you concerned that this distribution network will slow things down from what you guys had been doing at the mass sites?
You know, we're going to have to wait and see. I'm optimistic things aren't going to slow down because the mass sites still have a lot of vaccine. The one thing about municipalities that I think is a plus is they know their people. And I think there's a lot to be said for knowing your people, and people want to see their friends there. And so the efficiency I've seen in the municipal sites is going to go pretty well. So I'm pretty optimistic about how they're going to do.
And do you think, is it helpful to take the teachers then kind of out of the sign up process for the mass sites and have them, I guess the school district or the town will call them to go to the clinic? Does it help to not have them also trying to sign up for the same appointments?
Sure, it does. And I think you have to keep in mind, some of the teachers are going to be people who are 16 to 64 who had underlying conditions. And some of the teachers were in other high risk groups. And that's one of the things where we're just trying to get everybody done as quickly as possible. And I think the key message here is we want to get everybody vaccinated as soon as possible. And I really think by the end of April, we're really going to have the vast majority of Rhode Islanders who want to be vaccinated. And we're going to keep going, but they're going to have at least one dose at that point. And you know, the single dose efficacy is really good with these vaccines. So I'm optimistic about that as well.
And you also have the Johnson & Johnson coming online. Has there been any more discussion of directing that to a certain kind of population where it would be easier to do a one dose?
Yeah, mostly with Johnson & Johnson, we're actually distributing through all the sites. You know, I think it's one of those things where we're trying to give Rhode Island residents as much preference as possible. And I think that makes the most sense. Some people are going to want one and done, and that makes a lot of sense to me. I mean, I was talking to my brother over the weekend. He was hoping to get the Johnson & Johnson vaccine because he just wanted to be one and done and move on. And I think for a lot of people, if we can accommodate your preference, why not do that?
And I assume your message is still, though, take the first one that's available. They're all good?
Oh, absolutely. They're all great vaccines. Quite frankly, the best vaccine for you is the next dose available. Absolutely. Please just get your vaccine.
I will get back to what we talked about at the beginning. You're outside, Dr. McDonald. It's going to be nice the next few days. Do you expect that that will help the trajectory of this virus as well?
Oh, I do. In Rhode Island, I'm outside today because one, I can be. It's like if you don't like weather like today, my friends, you just don't like weather. And so thank goodness we've got such beautiful weather. This is when I want to be outside. I'm working outside today in front of my house because I thought, why not get outside? I'm going to go for a walk a little later on today as well. Encourage people to do that as much as well. Get outside. Let's get some exercise. Work off some of that quarantine 20 a lot of us put on, so to speak. Let's be honest, we didn't eat so well during the pandemic, my friends. So let's get outside and walk around a little bit.
Anything else you want to add today?
You know, folks, I think we need to be very thankful about where we are in the state and where we are in the country. I mean, overall, we're heading in a positive direction. If there's one message I just think we all need to resonate with is we're all getting through this together, whether we like it or not. And if we can just unify the state and unify the country, it's going to put us all in a healthier spot.
Oh, and actually, I had one more question I forgot. So is there, one of the things I know Massachusetts was dealing with this, that right around now you're dealing with a lot of people who are getting their second doses, who got their first doses a few weeks ago. Is that minimizing the number of appointments that are available for people who want their first doses? Is that kind of catching up? I know Rhode Island has shot up the ranks for first doses, still is in the 40s for second doses. Do you expect that to now level out? And what does that do to appointments and the next couple of weeks?
Yeah, you're going to see this little flip-flopping. And right now, this week in particular is a second dose week for a lot of people. And that's going to happen. And the thing is, we want to get everybody both doses here. You know, but I think that's okay. And I think it's the larger perspective we need to have here. In other words, it's about getting everybody the vaccine. Right now, fortunately, our cases are heading in the right direction. Hospitalization's heading in the right direction. And so right now, we have the time. We're getting up in the right spot. Having said that, I don't go anywhere without my masks. I got all of them, all kinds of ready here. Even when I'm outside, I've got my mask at the ready. In case a neighbor comes up and says hello, I am ready to protect them and protect myself.